Welcome to IMCAS TV, 10 Minutes with Regenerative Medicine and Dr. Gilbert Zakin. Thank you so much for joining us. You are a plastic surgeon from France, and one of the reasons it's so interesting to speak about regenerative medicine with you is because you've done an enormous amount of research in tissue healing. The first question I wanted to ask is, can you talk to us about GRF and PRP, growing factor and plasma-rich plaquettes, both blood products and both leading regenerative medicine into the future?
Yes, it's a very important subject, and all belong to regenerative medicine and regenerative surgery, and we are talking about regeneration of tissue, all the tissue. Growth factor are polypeptides which help to the multiplication of the cell, the migration, and the differentiation of the cell. Growth factor are very important action on tissular healing, on ontogeny, obviously. Angiogenesis is the building of the vessel,
right?
And it's extremely important in all the tissue healing. And the PRP, it's
the plasma-rich
plaquette. It contained a lot of growth factor because these growth factors are contained in the autologous plaquette that we have with the plasma-rich plaquette.
Right. And what are the applications of regenerative medicine in plastic surgery?
Oh, so you know that the plastic surgery is a very important area of research.
We spoke about stem cells
surgery.
earlier.
Exactly.
Yes.
And so we have to repair loss of tissue, and in plastic and reconstructive surgery, it's what growth factor and PRP can give. It's important to help the tissular healing. And there is a lot of way of research to improve this tissular and cutaneous healing, especially, and to do rejuvenation, for example, of the face with the PRP, of wrinkle treatment with this PRP.
But there's other applications as well besides plastic surgery, the reconstructive surgery.
Absolutely. We have application in aesthetic surgery, but also we have application, now we know that there is a lot of application in other specialties, like, for example, orthopedics or traumatology. We can improve the healing of the bone, healing of the cartilage. Also in dermatology to improve the healing of the skin, obviously.
Yeah.
In cardiac surgery of cardiac medicine, we know that it's important to do angiogenesis to repair a heart, for example.
And what do you think the future of regenerative medicine is? We're just at the forefront, the frontier
right
now.
We are at the beginning, absolutely.
And it's moving quite quickly.
Yes.
In the near future and in the far future, where do you see regenerative medicine going? Two-part question.
Yeah, I think we are in. It's a growing area of research.
Yeah, we're really at the dawn of the
we are at
the revolution.
Not the embryonic step, but
no.
we are at the beginning of this regenerative medicine and regenerative surgery. I think that maybe we have to know in the future, we have to better understand a very complex action and specific action of all growth factor, the action, the sequence of the action of each growth factor. Because when we try to understand the tissular healing, and more specifically in our specialty, the skin healing, it's important to see the role of each growth factor. It's a very complex orchestra of a lot of different
with all the different
action
players,
and cells, and all is very important. So a more deep learning. When we will have this better learning, we will develop a better treatment and therapy. And I think maybe for the future, it can be interesting to use a different kind of regenerative medicine. We know that, for example, stem cell The stem cell is a cell who can do multiplication and which secrete a lot of growth factor, and it can help also tissular healing.
Right.
So we can do combining therapy with stem cell, growth factor, platelet-rich plasma, and all that is very important.
It seems like combination therapy is the theme of the day. Everybody's been speaking so much about combination therapy.
It's important, but it's important to know what is exactly efficient.
What
And
works with
it's
what.
why it's very important to have basic science and experimental work, to have also clinical work and clinical study, to know what is the more efficient, what is the better way of growth factor administration, for example, what is the best sequence. Because actually some treatment are a little bit empiric,
Right.
but we see that there is interesting results, and really it's a very important way of research in plastic, reconstructive, and aesthetic surgery, and medical treatment and dermatology.
Well, I hope you can come back next year and tell us
Yeah.
what happened from today until next year, because it does move at such a fast pace.
With great pleasure.
Thank you so
Thank
much,
you very
Dr.
much.
Zakin. Thank you.